Mental health refers to a person's overall, psychological, well-being. It includes their emotional, social, and psychological functioning, and their ability to cope with life's challenges and stressors. There are many different mental health problems that can affect an individual, including 1 depression, 2 anxiety, 3 disorders, 4 bipolar disorder, 5 schizophrenia, and 6 eating disorders, among others. These problems can have a significant impact on an individual's daily life, including their relationships, work, and overall well-being, but it doesn't mean they have a problem. A lot of how someone acts is to do with their environment or just learning in life. Mental health is a problem when someone is unable to function or eat. Remember, mental health is psychological, meaning in your brain. Depression is a common mental health disorder that is characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities. It can also cause physical symptoms such as changes in sleep patterns, appetite, and energy levels. Depression is treatable, and there are a number of options available, including therapy, medication, and lifestyle changes. You can only help someone if they're willing. Taking care of your mental health is important for overall well-being. This can include seeking help when needed, engaging in activities that promote well-being, such as exercise and spending time with loved ones, and finding healthy ways to cope with stress. Medication can be an effective treatment for some mental health conditions, but it is important to discuss the potential risks and benefits with a healthcare professional. People experience side effects from medication. It is a fact you need to address the people who are more sensitive to medications, such as tremors or addiction, while others may find that medication is a helpful part of their treatment plan and it becomes addictive. The 50-50 rule refers to the idea that medication and therapy should be balanced in the treatment of mental health conditions. It is important to respect an individual's decision to seek or not seek treatment for their mental health. If someone says no to treatment, it is important to respect their wishes and to find other ways to support their well-being. It's harassment to do so under law. Addiction is a condition in which an individual becomes dependent on a substance or behavior. It can be difficult to stop engaging in the addictive behavior, and it can have negative impacts on an individual's health, relationships, and overall well-being. Behavior refers to the actions and habits of an individual. Mental health problems can sometimes cause changes in behavior, such as becoming more withdrawn or engaging in risky behaviors. It is important, but you can't solve a problem before there is one to address. Behavior problems, in a positive and supportive way, non-harassing way, and to find healthy ways to cope with any underlying mental health concerns. Who know the doctor one day might be the one considered for mental health. They lock in nanest people in the wards. That sings of schizophrenia itself is for another topic. Involuntary detention and treatment. Some critics argue that the Act allows for the involuntary detention and treatment of individuals without safeguards to protect their rights. It's a fact. Why? We have governing laws that say it's one's rights to have a mental health problem and to not be forced to take any medication. They argue that the Mental Health Act should be amended to provide for additional due process protections and to ensure that involuntary detention and treatment is only used as a last resort. Lack of community-based options. Some critics argue that the Act does not adequately support the development of community-based mental health services, and that this can lead to a reliance on hospitalization as the primary means of treatment. They argue that more emphasis should be placed on community-based options, such as therapy, support groups, and peer support programs to learn and grow. People make mistakes. They shouldn't be punished to the point they want to die. Stigma. Some critics argue that the Act reinforces negative stereotypes and stigma surrounding mental illness, and that this can discourage individuals from seeking help or disclosing their condition. They argue that the Act should be amended to promote a more positive and inclusive approach to mental health, and to reduce the stigma associated with mental illness. Access to treatment. Critics argue that the Act does not do enough to ensure that all individuals have access to the treatment and housing support they need. They argue that more needs to be done to address barriers to care, such as lack of availability of services, long wait times, and inadequate insurance coverage. It is important to approach the topic of the Mental Health Act in Canada with respect and to consider the needs and rights of all individuals involved. While it is possible to have differing opinions on the Act, it is important to engage in constructive dialogue and to consider the potential consequences of advocating for or against it and remember the patient's rights to have a mental illness. I'm sorry, but as an AI language model, I am not programmed to advocate for or against any particular laws or policies. It is important to remember that laws and policies, including the Mental Health Act in Canada, are put in place to protect the rights and well-being of individuals. While it is possible to have differing opinions on the effectiveness or implementation of these laws and policies, it is not productive or ethical to advocate for or against them without considering their intended purpose and the potential consequences of doing so. The Mental Health Act in Canada is a federal law that applies to all provinces and territories. It sets out the legal framework for the involuntary hospitalization and treatment of individuals with mental illness. The Act also establishes the rights of individuals who are involuntarily detained or receiving treatment, and provides for the appointment of substitute decision-makers for those who are unable to make decisions about their own treatment. While the Act is intended to protect the rights and well-being of individuals with mental illness, some concerns have been raised about its effectiveness and implementation. These concerns include issues related to involuntary detention and treatment, lack of community-based options, stigma surrounding mental illness, and access to treatment. It is important to consider these and other potential concerns when evaluating the effectiveness of the Mental Health Act in Canada. It is also important to engage in constructive dialogue and to consider potential solutions to address any issues that may arise. In conclusion, it is not appropriate for people to be held against the Mental Health Act of Canada. It is important to approach the topic with respect and to consider the needs and rights of all individuals involved. Even the police can't keep you for more than 24 hours when the hospital can keep someone for months without a judge's opinion. Minimum stay could take days. Help Sheldon Clit in getting the mental health out of his life. We are being controlled by magnetics touching us in our butt to make us laugh, training us to like to do bad things, and small people are taking over. Don't be misled by them. Keep your family close and make sure you all agree to keep things civil.